Hello, everyone. My name is Cameron Nix, and today I'll be talking about my overall internship experience. I'll be graduating with a concentration in community health education, so all of my experiences will be reflective of that. I actually interned with two separate organizations, Seeds of Healing, which is a nonprofit for HIV advocacy and awareness, as well as Novant Health, New Hanover Regional Medical Center Infectious Disease Specialists. You may formally know this as the HIV care team. Throughout this presentation, I'll be highlighting various things from the organization overview, the structure, the mission, the population served, and the funding of that organization. And for the purposes of this presentation, I'll be strictly focusing on Seeds of Healing and the organization overview. Then I'll be able to dive a little bit deeper into my work with Novant Health New Hanover Regional Medical Center and the responsibilities and projects that I facilitated with. Then I'll talk about my in-check competencies that I've covered, as well as my overall internship experience from my likes to my areas of improvement within my internship experience. The first thing that I'd like to highlight for the organization overview for Seeds of Healing is the structure. This is identified as an independent nonprofit organization. And so by independent, I wanted to emphasize that Seeds of Healing is not directly connected to Novant Health. It is not a part of the larger Novant Health organization. The reason that I'm able to complete both Seeds of Healing as well as the Novant Health New Hanover Regional Medical Center internship is through the founder and executive director. And that person is my supervisor, Dr. LaShonda Wallace. And this is because she currently works at Novant Health as a family nurse practitioner and is an advanced practice nurse. And it is through her work that I am able to complete both internships. I'd also like to highlight staffing. Seeds of Healing is a relatively new nonprofit organization. It started in 2016, and because of that, staffing is completely done by contracted workers, meaning they are contracted for 1 calendar year, and they have the opportunity to either terminate that contract or continue that contract. These are relatively temporary positions. However, they do have the opportunity in years to come to become more permanent. And so in descending orders from area of contact, it would be program coordinator position, the community outreach worker, media specialist, and the webmaster. I personally have more experience working with the program coordinator as well as the media specialist when helping facilitate with webinars and creating marketing materials for those events. I'd also like to highlight the mission. The mission statement includes things to deconstruct myths, to generate support for people living with HIV and those affected by it, and to eliminate disparities. These areas that I've highlighted all are reflective of the goal of Seeds of Healing, which is to provide resources for HIV advocacy, awareness, and education. Seeds of Healing, actually SEEDS is in an acronym, and that acronym stands for Sustaining Empowerment by Educating and Developing Sisters. So this acronym is going to be reflective in the population served. The population served is considered a marginalized population. And what I mean by this is that this is an historically underserved group of individuals. And so this ranges from people with a positive diagnosis of HIV, those uninsured or underinsured, meaning either they do not have insurance or the insurance that they do have is not enough to provide the necessary HIV treatment. And then Black, Indigenous people of color, or BIPOC individuals. And so Dr. Wallace in Seeds of Healing does emphasize particularly Black women and advocating for those individuals with a positive diagnosis of HIV as well. Additionally, I'd like to emphasize the funding of this organization. So it is primarily funded through grants and donations. The grants are broken down into block grants, or those that can be contracted for the same amount year after year, and those that are competitive funds, or those that are done for only 1 year and have to be reapplied for after that. For the block grant example, there is the NC Department of Health and Human Services grant provided for HIV and STI preventive services. And so Seeds of Healing has been awarded $55,000 for the next 3 years. So that's our block grant example. And then the competitive funds example is the American Rescue Plan Act, which is provided again by New Hanover County. And this is a one-time payment of $30,000. In addition to that, there's also donations by either sponsors for events, vendors, or participating individuals for Seeds of Healing. Going into the responsibilities and projects that I've helped with, this is where I can talk more specifically about my impact in Novant Health New Hanover Regional Medical Center. And so the responsibilities I've had include to correspond with staff and stakeholders. So this includes seeking out vendors and sponsors for events, as well as participating and communicating with Seeds of Healing staff, being primarily the media specialist and the program coordinator, and then the clinic staff for Novant Health New Hanover Regional Medical Center, being the clinic nurses, for example, who I see on a daily basis and interact with. I also engage with the SoTime platform, which is an interactive multimedia platform for particularly Black women with a positive diagnosis of HIV to have a supportive community. And then I also conduct active research, whether that be for COVID statistics to present to the Health and Human Services Board meeting, or HIV and HCV statistics or hepatitis C. And then that is reflected in the projects that I've helped with. That includes webinars for the SoTime platform. I've also found vendors for the YWCI Health Summit that will be held in May. And I've also helped create the Patient Advisory Council and the hashtag Think Red ILM 5K. For the purposes of this presentation, I'll be diving into my two favorite and most time I've spent onto those projects, being the Patient Advisory Council, as well as the Think Red event. The Patient Advisory Council provides an open means of communication and feedback for patients to provide to clinic staff and specific meetings. And so the Patient Advisory Council was previously not created for Novant Health New Hanover Regional Medical Center. Novant Health did have a Patient Advisory Council, but that was on a larger scale. So I was responsible for creating one specific to the Infectious Disease Specialists within Novant Health New Hanover Regional Medical Center. So in addition to creating an implementation plan, I also gave out flyers advertising the Patient Advisory Council, held interest meetings for patients, and also corresponded with patients via MyChart, which is an electronic medical recording system. Although I didn't complete the Patient Advisory Council, this does leave room for future interns to help with that. And then I helped create vendors and sponsors for the hashtag Think Red ILM 5K. This event is actually coming up. It'll be held on April 23rd. And so this is the logo, and this is a close-up image of what my Excel sheet would look like when I was finding those vendors. Lastly, I'd like to talk about my in-check competencies before diving into my overall internship experience. So these areas range from 1, 2, 3, 4, 5, and 7. So areas 1, 2, and 3 range from needs assessments and capacity for help, planning, and implementation. Areas 4, 5, and 7 range from evaluation and research, advocacy, leadership, and management. So these are all reflected in my time working with stakeholders and partners. And lastly, into my overall internship experience. My likes that I'd like to address was that this was a hybrid modality. I could go into the clinic in the Seeds of Healing office, or I could have the opportunity when necessary to work from home. I also gained practical leadership experience by engaging with sponsors and vendors and working with community organizations, including the YWCA. I also gained practical experience working with patients, especially with the Patient Advisory Council. The one thing I'd like to say for areas of improvement include the work-life balance and work intensity. This was a really high work intensity environment. However, the likes did outweigh those areas of improvement. But the lessons learned for this experience is to practice communication and maintain that work-life balance. If I would have communicated better that I needed to have more breaks or that I needed a better work-life balance, then that could have been something that I could have helped with. So we have covered all the necessary topics for this event, ranging from organization overview for Seeds of Healing, responsibilities and project outcomes, down to the overall organization experience and internship experience. Thank you so much, and I've had an amazing time.